Hi all, I'm Dr. Gayatri from Department of Conservative Dentistry and Endodontics. I'll be discussing about a topic deep margin elevation. Deep margin elevation is a minimally invasive restorative technique that is used on the cavities or margins that extends below the gum line, making access and boarding difficult. So instead of surgical crown milling, it uses composite resin to really locate the margin coronally, thereby improving isolation. So coming to indications of DME, it is indicated in deep proximal lesions where proper matrix placement can be done without violating the biological width, whereas it is contraindicated in subcrustal lesions, developmental defects, and in severely medically compromised patients. There are various elements for the success of DME. Use curved matrices for better adaptation, maintain adequate tooth walls, and achieve proper isolation using rubber dam, Teflon, and retraction cords, and layer the composite in small increments, preferably preheated. So there are basically two techniques for deep margin elevation. One is matrix and matrix technique, which is indicated for extremely deep margins. They're using double matrices and Teflon support. The other technique is the auto technique, where the snowplow layering technique without matrix is used. Coming to comparison between both the techniques, in MIM technique, two matrices are used, main matrix and sectioned fragment that is inserted between the marginal matrix, whereas in R2, it starts without a matrix for initial build-up, after which matrix is added. Matrix is placed before elevation in MIM, whereas it is placed after elevation in R2 technique. Traditional increment placement within a sealed matrix is used in MIM technique, whereas a snowplow technique with a flowable plus a viscous composite is placed and then cured together in R2 technique. Coming to biological considerations, if a superficial tissue attachment is preserved, DMA is compatible with periodontal health. Proper sealing it prevents inflammation and micro leakage, increases adaptation. And flowable composites offers a good marginal fit, but it should be thin to avoid shrinkage. So coming to conclusion, deep margin elevation preserves tooth structure, avoids surgery, and offers patient comfort. But more long-term studies are needed before it can match the predictability of surgical approaches. Thank you.